The first clinical is chest pain. The chest pain can result from pulmonary diseases. Chest pain is the main symptom of cardiac diseases. Chest pain may also occur in intestinal, gallbladder, musculoskeletal disorders. Heart attack is associated with crushing substernal pain, which is deep to the sternum, that does not disappear with rest. Now the next clinical is rib fractures. The weakest part of a rib is just anterior to its angle. The first rib is protected by clavicle. It is short and broad. But when it is broken, structures crossing its superior aspect are injured. Mainly brachial plexus of nerves and subclavian vessels are injured. Middle ribs are most commonly fractured. The fracture may injure internal organs such as lung and spleen. Fractures of lower ribs may tear diaphragm and result in a diaphragmatic hernia. Diaphragmatic hernia is the bulging of organs of thoracic cavity into the abdomen. The treatment includes rib fractures have been surgically plated or repaired, but the practice remains controversial. The next clinical is flail chest. Multiple rib fractures may allow a sizable segment of anterior or lateral thoracic wall to move freely. The loose segment of wall, anterior or lateral wall of thorax, moves paradoxically. Inward movement on inspiration and outward movement on expiration. Flail chest is an especially painful injury. It impairs ventilation and affecting the oxygenation of blood. The treatment of flail chest includes during the treatment, loose segment may be internally fixed with plates or wires to prevent the movement. The next clinical is thoracotomy. The surgical creation of an opening through the thoracic wall to enter a pleural cavity is called thoracotomy. Anterior thoracotomy. The making of an H-shaped cuts through the perichondrium of one or more costal cartilages and the posterolateral aspect. The intercostal spaces between 5th and 7th spaces are important sites for posterior thoracotomy to approach the thoracic cavity. Thoracotomy is done to approach thoracic cavity. Now the next clinical is pneumonectomy. The removal of lung is called pneumonectomy. The surgical incision is made through the thoracic wall. Entry is made through deep aspect of periosteal sheath, sparing the adjacent intercostal muscles to get entry into the thoracic cavity. The next clinical is supernumerary ribs. Persons usually have 12 ribs on each side, but the number is increased by the presence of cervical and lumbar ribs or decreased by failure of 12th pair of the ribs to form. Cervical ribs. The cervical ribs are common and they interfere with the neurovascular structures exiting the superior thoracic aperture. But the lumbar ribs are less common. What is the clinical significance? The clinical significance, they have important clinical significance in that they may confuse the identification of vertebral levels in radiographs and other diagnostic images. The next clinical is sternal biopsy. First, what is biopsy? The biopsy is the removal of a tissue or an organ to determine the cause of a specific disease. Now, sternal biopsy. The sternal body is often used for bone marrow needle biopsy because of its breadth and subcutaneous position. The needle pierces the structures in sequence from superficial to deep. First skin, then connective tissue, then cortical bone and vascular spongy bone. The sternal biopsy is commonly used to obtain specimens of marrow for transplantation and for detection of metastatic cancer and blood discresis abnormalities of blood. This was the sternal biopsy.